There are a series of muscles in the anterior compartment of the forearm, primarily which flex the wrist and digits. Many originate on the medial epicondyle of the humerus. As can be seen here in these images from the cat, two from the cat and then two from the monkey, there are both superficial and deeper layers of muscles. So if the superficial muscles are reflected, one can observe other muscles underneath them. The radius is the lateral forearm bone, and on the lateral surface of the forearm, one observes the flexor carpi radialis. It flexes the wrist, but it's lateral like the radius. It originates on the medial epicondyle of the humerus. It inserts on the second and third metacarpals at their base, and it flexes the wrist and abducts the hand. The ulna is the medial forearm bone, and thus the muscle on the medial surface of the anterior compartment of the forearm, which flexes the wrist, is known as the flexor carpi ulnaris, originating on the medial epicondyle and the olecranon and posterior ulna, in inserting on the second and third metacarpals, in addition to two carpal bones, and it flexes the wrist and adducts the hand. If one were to reflect back the flexor carpi radialis and ulnaris and the variable muscle between them, the palmaris longus, which is small and absent in many individuals, one sees the flexor digitorum superficialis, originating from the medial epicondyle of the humerus and the anterior radius, inserting on the middle phalanges of four fingers, all four digits, where it can flex the wrist and then flex the middle phalanges of the four fingers. Deep to this muscle, so if one were to reflect the flexor digitorum superficialis, one sees a deeper muscle, the flexor digitorum profundus, which inserts onto the distal phalanges of the four fingers and flexes those phalanges in addition to participating in finger adduction. The thumb is on the lateral side of the hand, and lateral to the flexor digitorum profundus is the flexor pollicis, which flexes the thumb. In anatomical position, the palm faces forward or anteriorly. It is supinated, but the head of the radius can rotate in the radial notch of the ulna, given that this is a pivot joint, and the pronator teres muscle can then pull on the radius and then pronate the forearm so that the palm faces posteriorly. The pronator teres originates on the medial epicondyle of the humerus and the coronoid process of the ulna. It inserts onto the radius and it pronates the forearm.